My name's Dave, and I'm making this video for people who had back surgery. I just had, about 6 weeks ago, back surgery, disc replacement surgery, ADR, artificial disc replacement, in my back here in Hong Kong where I live, in my L4 and L5 discs. Back in the day, I was quite active. I was a professional level dancer, and then I went into fitness and did all kinds of fitness, and then went back into some yoga, and then some spinning, and then some CrossFit, and then in CrossFit is where I get injured, and they found out about my back and discs. At that time, I had shooting pain down my leg, basically in specific points, and through chiropractic and physio and personal training, I kept the symptoms away. So the symptoms were kind of tingling in my feet. I found yoga to be quite helpful. I became a yoga instructor, and I was doing yoga for almost every day for about 4 or 5 years, and that helped it. And then recently here in Hong Kong, when we moved here, my symptoms came back. I've also had some epidural injections, about 4 sessions, and each epidural in the beginning lasted about 2 to 3 years or so. And then recently they kind of wore off. Basically, right now, before the operation, I would try to walk about a block or so, and my knee would get numb, so I'd bend over and get back up, and that would clear the pain, clear the symptoms, release the nerve. And then also my feet were burning and tingling. I didn't really have any pain per se. It was just that annoying quality of life, mobility issue, and feeling in my feet. So I got the operation, and it seemed to go well. I'm in 6 weeks right now, and I'm walking nicely. I still do have some distraction pain, which is basically before your operation, your nerves are all crunched up because you didn't have any discs, and now you have some discs, and so I'm about an inch or more taller, and my nerves are being stretched, and your body's being stretched, trying to adjust it to the new hardware in your body. At night, mostly have distraction pain in my feet, and every day it gets less. Pre-op, if you're going to get this surgery, I would suggest you practice. You practice no bending, lifting, or twisting, because you can't bend, lift, or twist in about 2 to 3 months after your surgery, because either you're doing fusion or you're doing ADR. Your bones have to adjust, have to heal to the implants that are in your body. No bending, lifting, or twisting. So you need to practice that before the surgery. Practice sitting down, getting up, dressing yourself, like sitting on the edge of your bed. There's lots of videos on YouTube about this. I got some shoes that you step in. They're called Kizik, KIZIK.com, which are really nice. Also, Converse has some shoes that you can step into, or you could use clogs. But I found these to be really comfortable. They look really cool. Let me take my shoe off for you. Looks like this. And you just step right into it. You need to prepare your environment. So put things at waist level, because you can't bend down and get anything unless you have some devices, grabbers. Another video I saw was telling you how to get up and down without bending forward. So you kind of tuck one foot to the chair and scoot forward on the seat, and then sit up. And the same thing too is when you're using the toilet. You can't bend, lift, or twist, so that's a good way that you can get up and get down to using the toilet. I didn't use any toilet risers or anything like that. You can buy those if you'd like, but I was able to use a counter and a window ledge to help me sit down and get back up. If you have a strong core, that helps too. But if you don't worry about it. Some items that helped me a lot that I found out on YouTube as well. Get slippery sheets. I have some bamboo sheets, and that helps you turn over in bed. So practice again, once again, turning over in bed, keeping your hips and your shoulders aligned, and having slippery items like slippery clothes. I found that I had used some Lululemon, kind of polyester, lycra shorts and shirt that I wore to bed, and that helped me with the slippery sheets to turn over, and I still wear them. You want to practice your log rolls where you sit on the bed sideways and then you kind of just lean over to the side to help and roll yourself down, then roll onto your back. Practice that. There's videos on YouTube about that as well. So pillows. I sleep with 2 pillows under my head. I sleep on my side. I can't really sleep on my back. So the doctor said you can sleep on your side, stomach, or whatever works for you. So I sleep on my side and I put 1 pillow behind me and 1 pillow between my knees. So I tried one of those pillows that are a U body pillow shaped things a lot of people use for pregnancy, and that didn't work for me. I would suggest if you're going to get a body pillow, get a good body pillow like a Tempur-Pedic or something like that. You also need to get some grabbers. I got these on Amazon, grabbers. And this one bends, so you can store it. But I keep them all over the place. I have 4 of them. I have one in the living room. I have these short ones here that I use in the bathroom. And this little notch here is magnetic. It helps pick up things. They also have one on here as well. And these are crucial. They help you get things. If you drop one, you need another one to pick that one up because you can't bend, really. Some other things, if you can get a recliner, that helps a lot. My recliner definitely helps sitting because the doctor said for me that you can't sit on the couch because it's too soft. Also, a massage gun helps too because sometimes with distraction pain, you might have a pain, not so much tingling, but a kind of a tight muscle pain in your leg or your back, and that seems to help me. Cups for brushing teeth. So I found this really helpful on YouTube. You have 2 cups and you brush your teeth. You can't bend over or spit. So you fill one up with water and you take a swig and you rinse your mouth and you spit it in the other cup. And you do that. And then you just dump them out. Get toilet tabs. And these are little plastic tabs. Got these on Amazon. Kind of look like a big popsicle stick and then might be a little bent. And you stick them onto the toilet lid or the toilet seat, and you stick them on the side, and you can stick them on the top or underneath, depending on what works for your toilet seat. And then later you use your grabber to grab it and lift the seat up. If you have any wipes that you might use for after the toilet, those definitely help. After about 2 weeks post-op, they took off the bandage on my incision. It was a waterproof bandage, and you're able to shower, and that was fine. But you peel it off, and then I got Mederma night cream to stick on my scar, and my scar was kind of nasty at first, but now it's looking good after 6 weeks, and I keep using it, and it seems to be working. There's also some silicone patches on Amazon that I can use too as well. At night, to sleep, I take some magnesium citrate, and also I had to take a LYRICA at night as well. So those 2 things help me out. Sometimes I take some CBD gummies that helps me sleep. In the beginning, it's kind of hard to sleep, truthfully, but once you kind of rest and figure out what you need to do, your body calms down, at least for me. I also have some CBD cream that I use on my legs to help out with the distraction pain. Some other tips. My husband sleeps in the other room. We don't have a king-size bed. I got up quite a few times to just basically walk around to help with the distraction pain, but he was nearby in the next room. Take naps. The smallest things for me in the beginning, walking into the living room, walking around the yard, the terrace here, that took a lot out of me. So taking naps helps. When you sleep, your body heals. Walking is the best thing you can do after post-op. walk, walk, walk as much as you can. Just maybe in the beginning, walk to the bathroom and walk back. Walk from the recliner to the table and walk back. Or walk in the yard or walk down the street. That will help regenerate your body as well. You don't want to be stiff. Sitting in your chair, get stiff, and walking actually helps diminish the distraction pain. My distraction pain is in my right shin because my L5 nerves are in your shin and down to your foot. It kind of feels like shin splints. It's gone away a little bit, but I still have it now and then. Some people don't have it, and some people might have it for 2 months or 3 months or 6 months, but everyone's different. So I used a walker for about a week or so, and then I used a cane about 3 weeks, and every day I got better, and I used the cane as insurance so I won't fall. Now I don't use a cane. Also, you want to do some nerve flossing, which is exercises for your leg. There's videos on YouTube where you might lay down on the bed, hold behind your knee, and lift your leg up, flex your foot, and then point it down. And it just moves the nerve, because when you're sitting, here's a nerve, here's your muscles, and they get stuck. So nerve flossing, like flossing your teeth, helps that nerve become looser, more elastic. Definitely helps with your distraction pain. Meds, you want to keep up with your pain meds. I came home from the hospital and I was on my meds for about a week. And the pain meds are a general overall meds, so not like LYRICA or anything like that. I was on my meds and I took them regularly, and medications that they gave me, antibiotic, vitamins as well. But you want to keep up on that. But the meds create constipation, so you want to keep up with your laxatives. And after a week, I didn't want to take the meds and I didn't really need them. I did take some ibuprofen, like Aleve, as well after getting off of those meds. But everyone's different, but the constipation thing is real, it's no joke. So you want to take your meds. As I said, the distraction pain, I take LYRICA at night. I only take it when I need it. Some people are prescribed 4 times a day. Do what serves you. For me, I just take it at night. The tingling also for your distraction pain is your nerves regenerating. If there's tingling, it feels like your hand fell asleep or your foot fell asleep, and that tingling, when it starts to wake up, is what you feel for distraction pain, at least for me. And sometimes I get like shocks, like specific points now I get shocks, and sometimes it's like, ooh, and sometimes it's okay. Everyone's different. Just take your time, slow and steady, wins the race. Do what serves you, what you think works for you. Listen to your body. If you need to take a nap, take a nap. If you need to take some meds, take some meds. Celebrate the small victories, like getting up from your recliner and walking over. And after every day, things get better. They definitely will get better. Slow and steady. In the comments below, in the description below, I'll leave some links for videos and my Amazon list that I have. Feel free to comment below, send me a DM, and I'll be happy to answer your questions. So I hope your journey and your surgery is a good one, and thank you so much.